Hi, I'm Ellen and welcome to Mentally Detoured. In parts 1 and 2 about depression, we covered symptoms, causes, and treatments. The topic of this video is the different types of depression. Some of these you may have heard of, but there may be a few that are new to you. Besides major depressive disorder, which is also known as unipolar disorder, there are 8 other types of depression that I'm going to talk about. To keep the video short, I won't cover them all at once. This video covers just 2 of the 8. The symptoms discussed in Depression Part 1 are those that refer to major depressive disorder, and those are the symptoms that other variations are typically measured up against. Here's a quick review of those 9 main symptoms: depressed mood, loss of interest in almost all activities, eating too much or too little, sleeping problems, moving very slowly or becoming easily agitated, no energy, feelings of worthlessness and indecisiveness, and/or suicidal thoughts. First up is persistent depressive disorder, which is a variation that is not as well known as some of the other types. Previously known as dysthymia, and probably still called that by some practitioners, PDD is a low-grade chronic depression. By that I mean that the symptoms are much the same as major depressive disorder, but are much milder. The symptoms must mostly be present for at least 2 years in order to receive a PDD diagnosis. In many cases, a sufferer of persistent depressive disorder may never be diagnosed because they feel the depression is just who they are. Many times they suffer much longer than 2 years. According to the Mayo Clinic website, with dysthymia you may lose interest in normal daily activities, feel hopeless, lack productivity, and have low self-esteem and an overall feeling of inadequacy. People with dysthymia are often thought of as being overly critical, constantly complaining, and incapable of having fun. Without treatment, someone with PDD is at risk for a major depressive episode, reduced quality of life, relationship problems, school and work problems with decreased productivity, substance abuse and eating disorders, anxiety, and suicidal behavior. The most effective treatment of PDD is a combination of medications and psychotherapy. Another type of depression that you may have heard of is seasonal affective disorder. Again, it has many of the same symptoms as major depressive disorder, and those symptoms can range from mild to severe. With eating and sleeping issues, patients with SAD tend to sleep too much and eat too much, especially carbohydrates. The symptoms typically begin in the fall, lasting through winter, and then begin to improve in the spring. SAD is more common in those living far from the equator where there are less daylight hours in the winter. SAD can be treated with light therapy, antidepressants, and talk therapy, usually in some combination, and it can be manageable. Interestingly, SAD can also be experienced in the summer. It is uncommon, accounting for only 10% of all cases of SAD. While it is not clear what causes summer SAD, heat and bright light are considered factors. The treatment then is to stay inside in the dark and the air conditioning. This can be socially isolating though when your friends are outside enjoying fun summer activities at the pool or the beach or vacations. Today we covered persistent depressive disorder and seasonal affective disorder. Are you wondering what the other types are? The list includes atypical depression, psychotic depression, premenstrual depressive disorder, peripartum depression, which is occurring during pregnancy, after pregnancy, or both, and situational depression. Bipolar disorder, a mood disorder that does include depression, will be covered separately. To sum up today's video, you can be a little bit depressed for a long time, but that is not who you are. Once treated, the authentic you will shine through. Also, winter can make you depressed. Not everybody likes cold, snow, and darkness. And apparently, a few people even get depressed in the summer because of the heat and the brightness. As we approach summer here in the southeast United States, full of summer sun and summer heat, I wish you all well. For me, bring on the heat. Until next time.